it's a good time to set a plan to really focus on the things that matter, like what screenings you might need, what goals you have, so we can set those goals and work collaboratively together.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hello, everyone. I'm your host, Dr. Anthony Gonzalez. Welcome back to a new episode of Baptist Health Talk. We're here to answer the most searched questions on trending health topics. We're focusing on your health conversations that often get pushed aside, the ones you normally talk about with your primary care doctor. We're covering the check-ins you shouldn't skip, the screenings that matter most, and a few common myths, all to take a more proactive approach to your health. We are joined by Ravindra Ganesh, internal medicine physician with Baptist Health Concierge Medicine. Thank you for being here, Ravi.
Thank you very much for having me. Good to be here, Tony.
All right, so when somebody sees their doctor at the start of the year, what are the most important questions they should be asking?
So I think it's a good time to check in, to say, hey, how am I doing? Where do I stand, right? It's almost like you're getting a status check. And then it's a good time to set a plan to really focus on the things that matter, like what screenings you might need, what goals you have, so we can set those goals and work collaboratively together. The whole aim of primary care is not only to manage things that have gone wrong, but also to prevent things that we can.
Well, as a kid, you're taken to a pediatrician by your parents. Then there's a period of life where I see a lot of patients as a surgeon where I say, hey, who's your primary? And they're 40 or 50 years old. Oh, I don't have a primary, or I don't go to the doctor. When should we be going to a primary? At what age? Or do we have to have a medical condition to go to a primary?
I honestly don't think you should. We go to the dentist every 6 months for preventative work to make sure we don't get cavities. I think that going to see a primary care physician once a year is important for everyone, just for a check-in, some vitals, catch blood pressure, weight, talk about anything that's bothering you.
And does your age and family history play into what you're going to do for me when I show up in your office? Whether I'm 30 or 40 or 50?
Oh, absolutely. So when you see someone for a primary care visit, you're thinking about the whole person. So you're thinking about their genetic makeup, and that's what the family history tells you. So you know what they're at risk of just based on being born. Then we look at who they are, how old they are, their lifestyle, their other risk factors like smoking, weight, how stressful their job is. And we put together a plan based on what they're most at risk for to start screening for that and implement behavioral changes that can help.
Yeah, you talked about a plan, and obviously those are part of goals. So when somebody comes to see you, whether it be at the beginning of the year because they want to try off a new year, or it's that time of the year for their checkup, what type of goals do you set with them? Yeah, I want you to lose 100 pounds, let's lose 100 pounds over the next year, kind of an unrealistic goal.
Yeah, so there's actually science behind this, right? And goals are best when they're collaborative, where both you and the patient agree. So it has to be important to the patient and something that's medically important to you. And then you have to kind of set, mini goals. Because like you said, telling somebody lose 100 pounds in a year, it's kind of a daunting task. But if you said, hey, let's work on some stuff and let's see if we can lose 10 pounds by our next check-in in 6 weeks, that can be more manageable. You hold them accountable and kind of works with that whole lifestyle reinforcement thing.
And if I'm healthy, I'm young and healthy, should I be taking supplements and vitamins? Is there enough in the food that we eat today?
So that's a really good question, because it depends on your diet. If you're working 16 hours a day and your main source of nutrition is McDonald's, probably not. But if you're eating a balanced diet where you're getting fruits and vegetables and your plate has whole grains on it, you honestly are probably getting everything you need. Now, one of the big things that we face is that there's a lot of health influencers who like to promote supplements, and oftentimes my patients come to me with a list of supplements that they take. And it's a good opportunity to sit down and talk about it, see what they're actually doing for them, if they feel better, if they need them. And sometimes coming to your primary care doc can save you $80 a month in supplements.
But they don't really need all those supplements.
Oh, no.
Wow. Okay, so I come to you as a patient and I don't know whether I need to be taking labs. I don't know whether I need scans. Do I need vaccines? How do we prioritize what's important for every patient?
Yeah, so kind of based on that whole thing with looking at your age, your family history, what you're at risk for, there are guidelines out there for what vaccinations you might need. I think currently the recommendations are that everybody have a flu vaccine every year. Everybody gets a COVID booster if they're at high risk. So if you're over 65 or you have any comorbid conditions, tetanus every 10 years. So we look at your records and see what you need. It's a lot less rigorous than when you were a kid and had to
Yeah.
get shots every 6 months. But then, in terms of labs, it's good to get labs on people, especially if they're starting to show some of those metabolic changes, gaining weight, higher blood pressure, not sleeping well, just to start screening for those medical conditions that if we catch them early, we can head off with lifestyle rather than waiting to have to take a pill or do a procedure.
And then what about some of the preventive measures and lifestyle changes? What type of things do you tell people about smoking and alcohol and exercise?
Oh yeah, so that's great. So I generally break it down to three different buckets, right? So you want to maximize recovery. So sleep, downtime, time away from your electronic devices, probably including the one you're watching this podcast on. You need time for kind of activity to maintain your metabolism. So that's exercise, whether it's formal exercise or walking, short walks in between to kind of break up your day so you're not sitting all day. And then it's avoiding toxins. So alcohol um, in moderation. I think the latest guidelines say there's no actual safe amount, but most people, if they do 1 to 2 drinks every day, it's not as bad in terms of effects on liver, etc. And, obviously smoking is a big one that we tend to focus on. The other thing to think about too is kind of toxins in our food, because when we eat a high fat diet, that does kind of lead to a lot of the metabolic conditions that we're trying to avoid.
Sleep. People underestimate the importance of sleep. How much sleep for the, everyday listener adult who's watching Baptist Health Talk? How much sleep do I need?
So that varies depending on who you are, right?
Mm.
Average is about 7 hours, which is why we give that to the recommendation. But there are some people who do fine on 6 hours and never feel tired. And there are some people who need 9 hours to feel refreshed. So whatever sleep cycle you're set on as a young adult that makes you feel refreshed, it's important to kind of stick to that, because data shows that if you start changing that with shift work or sleep compression, like when you have kids and you have to get up early, and if you used to be a long sleeper, that actually worsens your outcomes.
Wow. All right. So blood work. I
Mhm.
go to the primary doctor. I'm always going to get my blood drawn. Is that part of like every visit? Is that important? Cholesterol, the PSA in a man, so forth.
Yeah. So, the guidelines kind of are a little bit not firm on what to do with somebody between the ages of 20 and 40. But once you're above 40, the recommendations are, check the A1C, looking for glucose control to catch diabetes early. For men over the age of 45, it's about time to start thinking about whether to do a PSA or not. Once again, the guidelines don't necessarily recommend PSAs, but I make it part of my practice because I'd rather have that data than not. The the idea is that sometimes you put people through biopsies, et cetera, that you don't need to.
Hmm.
But I think having the data and having that nuanced conversation with your patient with short-term follow-up is better than missing it in my practice. Cholesterol, we try and do in everybody over 40. If somebody's gaining weight or they have a family history of heart disease, I'll do it earlier. And, for those people with a family history of heart disease and high cholesterol, we often do kind of get a coronary calcium scan to see how much calcium we have anatomically, because that guides our decision making.
Well, and then, some people say, I may have something I'm feeling, and I don't think it's that important to really bring up with my primary physician. A lot of people live from ER to ER, urgent care to urgent care. Are there common things that, you've seen as a, experienced internal medicine doctor? Do you say, if you have a headache over a long period of time, or if you have this type of feeling, a pressure in your chest, I don't know. I'm thinking of common things as a
Hmm.
physician, as a surgeon, that you really shouldn't put off. You need to talk to your primary doctor about it.
Yeah, no, I think that those things that are potentially concerning and might need long-term management, like chest pain, headaches, shortness of breath, even chronic diarrhea. But basically, my rule of thumb is this: if you find yourself in the urgent care more than twice a year, you probably need to talk to your doc because we can probably save you that urgent care wait, that bill, and we can probably prevent that and keep you, at home in the evening instead of in a waiting room.
Yeah, and you actually bring up a good topic in regard to catching something before it happens. Before you go to the urgent care with chest pain, you mentioned a calcium scan. What are the things that you as primary docs can pick up on somebody before they even have symptoms of a real condition?
So, one of the things that's underrated is blood pressure, right? We have very strong data now saying that, if your blood pressure is over 130 systolic, that's a real risk factor for heart attacks and strokes. You don't feel your blood pressure. And if
Until it's really bad.
exactly, and you can be walking around with a pressure of 180 systolic and not know it
Until you
because
have
it's slowly
and tell us,
increased.
what are the consequences of high blood pressure?
There's so many, right? The ones we think about are heart attacks and strokes, and those can be catastrophic. But they also can have problems with their eyes, with those tiny vessels in the back, and lose vision. You can have problems with your kidneys, where you start to lose kidney function. And for all the men out there, you can have problems with your male equipment as a result of high blood pressure.
So we talked about going to the doctor early to maybe pick up high blood pressure, get screenings to prevent heart attacks. What other things can you guys screen for that you do regularly for patients that can prevent a real advanced condition later on?
So there's some that are standard and some that are evolving. So we encourage people to come in, get their mammograms every year, starting at age 40, because we always want to catch breast cancer when it's small and easily treatable. We have people come in for their pap smears every 3 years now because the data is coming up better on HPV. And that's really important, right? Because we want to catch women before it gets to cervical cancer so we can treat it as well. And, we're starting to get evolving data with the new cardiac markers that can predict your risk of heart attack and stroke. And these are things like lipoprotein A. There's a couple of new tests that are on the horizon. They're not fully covered by insurance yet, but there's a blood test that looks for about 40 different kinds of cancer called a multi-cancer early detection test. And the Army started covering it, so hopefully other insurances follow suit. And then lately, there's been, in the last couple of years, there's been a lot of people doing whole body MRIs. And that is a powerful screening test, but it
Yeah.
also has its own kind of worms where sometimes we find stuff that leads to workups that we don't need.
Yeah, I had a friend of mine who told me he had one of those, paid that out of pocket just to be able to get that, screening, because I guess there's some indication of that. All right, so I haven't been a good patient. I haven't been going to the doctor. Ravi, how do I kind of get up back on track? What should I be doing now that I haven't been getting my PSA, I haven't been getting my cholesterol, I don't even know what my blood pressure is, I don't even weigh myself. I don't have a scale at home.
You're a typical doctor then.
No, actually, I do go to the doctor every year, but I was,
Yeah.
I was impersonating a bad patient.
Yeah. It's never too late to start, right? Come on in, find a primary care doctor, come in and get a health assessment. And we'll take you in, we'll do your weight, check your blood pressure, check your vitals. We can make assessments as to kind of, your lifestyle, your sleep, your activity level, your stress level, your diet, and exercise. And then we'll do the blood work to kind of catch where you are. And, as a middle-aged man myself, the labs that we would get on somebody would be looking at kidney function, we'd look at liver function, a blood count, and we'd look at your cholesterol. And we do the screening for PSA. And that would be the basics that we do, depending on your risk factors, what you've had in your family history or what you've personally had in your past. We may add more testing, like looking for thyroid or something else.
Yeah, talk about that family history. That's important, right? How important is that? And are there certain populations of family histories that we want to alert that you need to be getting certain screenings?
Absolutely. So, family history is incredibly important, and it's very it's your genetics, right? I mean, it's what you inherit from your parents, and there's obviously the family history of coronary artery disease, right? So, if your dad had a heart attack, we're going to screen you to make sure that you're not developing the same things. Cholesterol runs in families, high blood pressure runs in families, autoimmune diseases run in families. So if you told me, hey, my mom developed autoimmune thyroid disease, I'm going to screen you because the odds of you developing that are high. And the big one is cancer.
Yeah, I was going to say cancer is
Yeah.
big, right?
Yeah, family history of cancer, you may have some genes that predispose you. And the the testing for that is it's kind of something that we really have to have a very good discussion with the patient about, because I could do a genetic panel on you and say, hey, you're at risk for this, but does it actually change what I'm doing, and does it actually help the patient besides giving them sleepless nights?
Yeah, a lot of anxiety.
Yeah.
All right, so I'm going to make an appointment with Ravi. I'm going to make an appointment with Baptist Health primary physician to get my checkup. What should I be doing even before my appointment, as I wait for my appointment, to kind of improve my health? Kind of just things that I can do around the house or in my neighborhood or at the dinner table, to improve my health before I get to the doctor.
So, making the appointment is the first step. And then once you're making the appointment and you're waiting, it's time to kind of assess where you are so you can give us a good history. So, a lot of times the things we do unconsciously, we don't actually take stock of. So starting to think of, how much do I move during the day? How long do I sit? Is my ergonomics correct? Am my computer, do I wind up with neck pain, shoulder pain from that? And then, you start to think about your day, and do I take the closest spot at a supermarket, or do I try to, park a little bit further and walk? Do I go outside with my kids and play? Do I ride my bike, or is it gathering dust in the garage like mine is? And then, you start to think about what you're eating. And it's a good time to kind of just take stock, because sometimes we don't notice, having an Oreo or two with the kids while we're watching TV doesn't register. But if you're starting to take that stock, you'll start to realize, hey, I'm actually eating a fair amount of food from a bag. Or, at dinner time, my plate doesn't really have a whole lot of green on it. So it's a good time to just start taking stock. You don't necessarily have to change anything right away, but just collect that data. So when you come in, we can have that really good conversation and pick small things to change so that it doesn't feel like all of a sudden you're in boot camp.
Wow. Yeah, I think it's just taking an inventory of what's happening in your own life, because you get to the doctors and you don't even know, well, what you did or what you ate and when you're going to ask them what they're doing. So I think taking a personal inventory. And there's a lot of apps and other things that we can use to help us with that, isn't there?
Yeah, no, I'm a big fan of the apps. So, the apps to track kind of what you're eating, like MyFitnessPal and Lose It, are great because they force you to look at portion control, right? And what we think of as a portion is 2/3 of a dinner plate. Really and truly should be 2/3 of a smaller plate. So
Plate's a little bit too big, huh?
yeah. So it makes us kind of think about, like how much we're actually consuming. Like most things, it can become an obsession. People can start to really get into counting calories, and it can be healthy, it can be unhealthy. So we always have to, kind of strike that balance. And wearables are kind of the same thing, because I do like to see how many steps my patients have taken, how active they've been, how much they're sleeping. But sometimes people get a little obsessed with that, and it starts to really stress them out and throw off the rest of their life.
Yeah, we need to manage stress for sure. Wow. So this has been a great conversation, and thank you for sharing your insight to our audience. Remember, viewers, be sure to hit that subscribe button on our channel to keep up with the latest health and wellness information and tips from our experts. Thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.